And it's a pleasure to be here. Let me get my slideshow up here. Okay. My name is Amy Meek, and I'm with the Kansas Children's Cabinet and Trust Fund, and I'm just thrilled to be here this afternoon to help kick off this summit. I want to give a little bit of background on the Kansas Children's Cabinet and Trust Fund for those that might not be familiar. We were created in 1999 by a legislative session to oversee the expenditures from the Master Tobacco Settlement Agreement. And 95% of the state's portion of that Master Tobacco Settlement Agreement was dedicated to improving the health and well-being of children in our state. We have 4 overarching responsibilities that are directed by statute to undertake. The first is advising the governor and the legislature regarding the use of money credited to the Children's Initiative Fund, evaluating programs which utilize Children's Initiatives Fund money. Third is to assist the governor in developing and implementing a coordinated, comprehensive delivery system to serve children and families in Kansas. And the fourth is supporting the prevention of child abuse and neglect through the Children's Trust Fund. A lot of the funding for the Children's Initiative Fund goes to other state agencies that oversee programs. We do have funding that goes directly to the cabinet for the for the Early Childhood Block Grant. And then we also receive a federal funding through the Community-Based Child Abuse Prevention Grant. And we grant that money out to organizations across our state to help support the prevention of child abuse and neglect. I wanted to tell you this afternoon a little bit about our early childhood systems building work that we have been working on for the last year and a half. It started in December 2018 when Kansas was awarded a federal grant for funding for the Preschool Development Planning Grant. Kansas State Department of Education received that grant, but it was very much a collaboration between state agencies, including the Cabinet, Kansas Department for Children and Families, and also the Kansas Department of Health and Environment. One of the main goals for that planning grant was to set out to understand the opportunities and gaps in our current system and what Kansans envisioned for their children and families. And the first part of that work included getting a needs assessment, a comprehensive needs assessment, gathering information across the state to help us see what the state of our early childhood system was in Kansas. We did that through community engagement sessions in 53 of those sessions across the state. We did those last summer. We also held parent cafes, surveyed providers, gathered existing needs assessments, and through that we heard from over 6,000 Kansans, and some central messages emerged. One was that the experiences of families with young children in Kansas are shaped by where they live, both across the regions of the state and within their communities. And second, young children are growing up in families where basic needs are not being met. We also had some key findings that emerged. Accessibility. Families with young children experience inequitable access to high quality programs and services. The availability isn't always there. There's a gap between the services that are available and the needs of the families. Navigation is challenging. Families have to adopt a connect the dots approach to navigate services, and there's often disruptors as they're trying to navigate that. We know our workforce needs support and needs attention. We need help with compensation, financial relief, ongoing training and support, and then also work around retention and recruitment. We also know that our facilities are in need of some care and some upkeep. Collaboration.
Gymnastics. I told him to go.
Collaboration is something that stakeholders and providers desire, better collaboration and cooperation, and also greater systems alignment. to fully realize the efficiency of our system and to make things more efficient. But also we had a lot of bright spots that emerged, and those are things that we want to help elevate. We want to share those examples because those are things that we'd like to replicate and elevate and continue across our state. From that, a All In for Kansas Kids strategic plan, a 5-year plan, was developed with a vision that every child thrives. And through that, in that strategic plan, there are 7 main goals: state level coordination, community level coordination, family knowledge and choice, private sector collaboration, capacity and access, workforce, and quality and environments. And in those 7 goals, there are strategies, there's tactics and indicators of success. And there's also a key that helps stakeholders in Kansas see where they fit into this work. And you can see that key over on the right-hand side of this slide. We also know that this is, it takes a mixed delivery system. And at the cabinet, we have a blueprint, which is a framework for early childhood in the state, and it's aligns with the strategic plan. You'll see in one of those bubbles, home visiting services. It's very much a part of our mixed delivery system with, in addition to a lot of other services in our state that we need to make a robust early childhood system for our families. And our goals are that all families have informed, timely, and equitable access to quality services, that all families get the right services to match their level of need, taking into account their unique situations and experiences, and that public and private partnerships are strong and that they're key to making sure that all of this work gets done. I wanted to just highlight where you can find the strategic plan, because I think we have a really cool way for you to look at it without scrolling through a lot of pages. It's on our Kansas Children's Cabinet website, which is kschildrenscabinet.org. You can click on different goals and strategies within that and navigate. And it's a really cool way to read the strategic plan and go through it without having a hard copy in front of you. I wanted to shift to the response to COVID, because I know that's the pandemic is on all of our minds, and it has been a disruptor in our work in many ways, and made us rethink and be innovative in how we do our work. And I just can't thank you all enough. It's been really, really incredible and amazing to hear how you all have persevered, how you have just really done what you needed to do to serve your children and families and continue services. We have heard so much about how things have in many ways been seamless. You have shifted to virtual visits, texting, phone calls with your families, more frequent visits because, or contacts, more frequent contacts because your families have needed that, and you have adapted and to meet their needs. We've heard about visits that have happened on front lawns or a provider in the driveway while the parent and the child were on the front porch to maintain safe distance. We've heard about front porch drop-offs of materials and resources, and it's just really incredible. I just want to thank you, tell you we see you, you matter, you're so appreciated. And we also know that going forward, we're going to come out okay, because we have you and we have providers in our field that are so dedicated to what they do. So at a state level, we have CARES Act funding, that's federal funding. The first round was county level support. So some of you may be involved in that. I hope that early childhood has been a part of the county plan in your county. But the second round of the CARES Act was state level support, and there's an early childhood component, which is so exciting. There was 3 main pieces to that. The first is the Early Childhood Consultant Network, and that is to help early childhood services and providers respond to the crisis. We know that facilities or childcare facilities have had to adapt to maybe how they receive families into their program or drop off children. They've had to implement different new PPE precautions and safety things. And other service providers across the state. So that is one of the new CARES funding supports. Another is the Early Childhood Workforce Health Fund. And we know there's lots of uninsured early childhood workers, and this is a fund that will help with medical expenses directly related to COVID-19. And the third funding is Technologies for Families. I want to talk just a little bit more about that because it has a home visiting connection. This is a fund that will provide access to equipment and devices to support virtual access for families served by early childhood care and education providers. You must be an organization partnering with a state agency to deliver one of the 7 home visiting models and be able to distribute technology directly to families. Those models are attachment and biobehavioral catch-up intervention, the Healthy Families America, Parents as Teachers, Early Head Start, Nurse Family Partnership, Universal Maternal and Child Health, and Infant Toddler Services, or Part C. 100% of these funds must go to purchase devices and connectivity equipment or supports, data plans, hotspots, and those are going to be distributed directly to families in need. We have, I still have funding available. The application is still open. I know many of your organizations have applied, but we want to make sure that as many families as possible are served through this funding. So if you have not applied or you'd like more information, you can get on the Children's Cabinet website to find out about that. That funding all will be spent, has to be spent by December 30th. So a pretty quick turnaround, but this is, I think, also the time when families are really in need of these devices or ways to connect so that they can continue home visitation services. So there are some next steps with the strategic plan. And like I said, we are having to shift just a little bit and think about how the pandemic is affecting us, but we're determined to continue this work and move it forward. The Children's Cabinet was awarded a renewal grant or a preschool development implementation grant in April of 2020. And so we are moving forward with some of those strategic plan tactics and some of those that are kind of in the works we just wanted to highlight. One has to do with the workforce and goal 6. It's around recruitment and retention and also supporting career advancement. We're working on a workforce registry. This will really help and support our workforce and our providers, help to connect and align some other systems that we have around the workforce already, and really help our workforce and our providers navigate things and help hopefully make our workforce a lot stronger. We also have a common application that we've worked on so that we have a streamlined process for organizations to apply for multiple funding opportunities that will hopefully save them time and save them some effort in being able to apply for more of the funding opportunities. And we are seeing that in action, and our applications are open for some quality subgrants. We're really excited to have some subgrants. These are going to be designed to help communities, service providers, and other early childhood stakeholders address some of these needs and gaps that were identified in from the needs assessment. So that application is open and also on the Cabinet website. We also have a really cool project, Our Tomorrows, and it was one way that we collected feedback and input for our needs assessment last year. And we are continuing this effort because it's so important that we hear from Kansas of what current challenges and needs are and struggles, and not only families, but our providers. And it's open for anyone to share their stories. We want to continue collecting those. we had every county, 105 counties in Kansas, participate in our needs assessment, which was really cool. And we want to continue hearing from individuals across the state. What we can do with those stories is look and see if there's trends, what's emerging. It helps us to prioritize efforts. We can look at like a county level information from those stories if we have enough stories in one county. So it's really cool. I invite you to share a story or have your families share stories. We want to get perspectives from as many Kansans as we can as we move forward. So looking ahead, I wanted to highlight a few things of how you as home visitors can stay connected. We have a weekly email update and you can sign up for that. We also have bi-weekly webinars and those take place every other Wednesday at noon. So you're welcome to join those, or if that time doesn't work for you, those are posted on the website and you can access those at your convenience. Again, you can share your story. And then we also have an early childhood stakeholder meeting. That meeting will be, the next one will be this Friday at 1:30. But those take place every other month on the first Friday in the afternoon following the Children's Cabinet meeting, which is in the morning. So this Friday we have a Children's Cabinet meeting at 9 and then an early childhood stakeholder meeting in the afternoon. The Children's Cabinet meeting is a public meeting and anyone is welcome to view that and watch. And then all of you are invited to also participate in the stakeholder meeting in the afternoon. We also have a newly kind of advisory group that we used to have one long time ago, and we've decided that that's one thing that we need for that systems alignment in our governance structure. So we have the Kansas Early Childhood Recommendations Panel. They started meeting in July, and their next meeting is on Friday, October 16th. They meet every month on the third Friday. And anyone is welcome to view that. It's on a YouTube live stream. You're welcome to share comments during the meeting, but you're also, we have an open forum. And since we're not meeting in person, we have that as part of our agenda. It's a standing part of the agenda. And so anyone is welcome to forward comments ahead of that meeting to Debbie Deere. The membership for this panel includes 40 representatives from across Kansas, and this is state agencies, statewide nonprofits, community-based organizations. We have parent representation, Head Start, higher education, workforce advocates, and home visitation is also represented. We have a Kansas Home Visiting Leadership Group. This is part of our governance structure. The panel is kind of an advisory group for the Home Visiting Leadership Group. Things can go be elevated up from the Kansas Home Visiting Leadership Group to the panel for a recommendation, or the panel might have some work that they would like the Home Visitation Leadership Group to work on. So the panel is connected to home visiting work that's going on in the state. As I want to leave a little bit of time for any questions, as I can't see the chat right now, but I just want to encourage you this week. I know we'd all much rather be attending in person, so this is a little bit different, but I'm grateful that we're able to find a way to have this summit virtually. And I know if you've signed up, that means you really are interested. And I just encourage you to prioritize your time to attend this week. I know there's lots of disruptions, but I know you all need actually a break and to be able to immerse yourself in this learning this week as well. And I would encourage you to seek out others that you can connect with or network with after the summit. I know for me, that's always been something that's been super helpful when I attended a conference, to have someone that I can reach out to for support or ask questions. And lastly, I would just ask you to enjoy the week. I'm really excited about all the breakout sessions that were available, and I hope that it's just a really enjoyable time of learning and connecting with others. So I'm going to stop sharing here. Oh, one more slide. I do have my email address and also Melissa Ricker, our executive director's email address on here on the screen. And kschildrenscabinet.org. You can find all the information that I've shared or a way to connect if you have questions as well. But I'm going to come back and see if there's anything in the chat.
Not yet, Amy. If anybody has any questions, feel free to unmute or put them in the chat.
I love seeing all of you that posted in the chat, though, where you're from. It's really, really exciting. I know I gave you a lot of information, so feel free to reach out to me or anyone else if you have questions that come out along the way this week that connects back to anything that I shared. Okay. Oh,
well, we do have one question. I don't know if you're seeing it yet, Amy.
Yeah, I see Nissa's. Yeah. So some of the ideas for the Technology for Families grant. Yeah, we have in those applications, we've had organizations apply or programs apply for tablets for their families and hotspots so that they can connect, they can better, you know, some of them, they might not have the minutes on their phone or have good Wi-Fi access. So a lot of the applications that have come in have been for maybe a variety of different things. Some might need some cell phones and some might need tablets or laptops. So it's really about meeting whatever the needs are of the families that you're serving. And then when should we expect to hear about the Tech for Family grants? I believe very soon. It is still open, but I think the committee has, it goes to a committee to then approve those grants. I believe it's going to be very soon. We know there's a short turnaround on that getting that money, those devices ordered and delivered to your families. I'm not sure how long the deadline will be open. I would encourage you to apply as quickly as you can. It's a very easy application, easy to fill out. There's support, there's contact information on there. If you need support filling it out, then we want to make it as easy as possible for you to get the funding and get those devices to your families. Okay. Oh, somebody received the award. Great. Yeah, there was kind of a bigger first round, and then I guess it's still the second round that's open. It's open. We want to make sure that the funding goes out. So we're gonna try to keep it open as long as we can. Looking at the time, I know you have to transition to another Zoom, and you might need to take just a little bit break. So since there's no other questions, I'm going to go ahead and close it out and wish you a great